쇼트 주자. I will use allogenic bone. 코로 숨 크게 들이마시고 10초만 참아보세요. 계속.
Yeah, he will use the sinus graft with the allogenic bone. This is the shows is not demineralized, so that it's freeze dried the cortical allogenic bone materials.
Sinus cavity is so huge. It is saline.
Dr. Kim, what do you usually how much the cc's of the allogenic bone grafts for the sinus graft?
Depending on the size of cavity, I will always pack. I always place the graft material tightly inside the sinus cavity.
Yes.
Because the allogenic bone has severe resorption rate around 30%.
Yes, I see.
So overgrafting should be considered, especially when using allogenic bone.
Yeah, usually the allogenic bone is very good for the benefit of the bone forming, but sometimes the resorption is a severe problem. So he said the overgraft for the prepared and because of the next time will be slightly resorption of the allograft materials. Packing inside of the sinus cavity with the allogenic bone. And but this allogenic graft bone is not demineralized, so this is only the freeze dried allogenic bone graft materials. Tight compact of the graft material inside of the sinus cavity.
I usually pack the bone until I can feel some rebouncing.
Ah, yeah, I see.
Okay. Packing is on.
Yeah, Dr. Kim said the medial side is a very important medial elevation of the sinus membrane of the medial side of the sinus cavity. After then, the fully packing of the allogenic bone graft materials, because the allogenic graft bone is very good for bone forming, but sometimes the resorption is.
I will place second premolar and molar implant on the right side.
Yeah, after the graft material inside of the sinus cavity, after then he placed the implants, and the second premolar area is the 4.0 and the 10 millimeter TS3 implants, and the second premolar area, and it looks the good primary stability.
Yeah. And post-molar area 5.0 by 10.
Yeah.
So I'm worrying that I could get initial stability in the post-molar area because the residual bone is quite thin.
Yeah.
So I used only initial drill.
Usually the initial drill diameter is 2.8. Yeah. After then, he placed the implants. The diameter is 5.0 for the primary stability.
So I could get appropriate stability around 50.
Oh yes.
Yeah. One more.
You mean 50?
Yeah. Sorry, 15.
15.
1.5.
1.5. Yeah, 15 Newton centimeters of the primary stability of the first molar area, and the second molar is also the diameter is 5.0 and the 10 millimeter length, and this is for the second molar area.
Second molar is so good.
Yeah, primary stability is very good.
Okay. Cover screw.
Yeah, he did the 5 implant installation of the right side.
잡아줘.
And for final depth control with the hand wrench.
It's good.
Good.
A little bit deep.
Yeah, he did place the implant. Fixture is slightly about 1 millimeter under the crestal bone. But sometimes very difficult because of the very residual alveolar bone height is very low.
Sometimes when placing implant in very thin residual bone height case, I have experienced some buccal bone plate fracture.
Yes.
But in this case, by making initial drilling point in the ideal position, I could minimize the buccal bone plate fracture.
Yeah, I see.
Suction.
Dr. Kim did only the initial drill of the molar area.
화이트 미리 다 준비했어.
Even though usually the initial drill the diameter is 2.8 millimeters, but the final installation of the implant is diameter is 5.0 and the length is 10 millimeters.
화이트 다 똑같아. 좋은데. And in canine area, I will do GBR.
Yes, with Ossbuilder.
Cortical perforation will be done.
Yeah, he make a hold of the buccal side of the alveolar bone and for the cortical perforation for the blood supply of the GBR. Yeah, this is the anchor. The anchor height is about 1 millimeter, 2 millimeter. Yeah, he did the anchor. The height is 2 millimeter of the canine area, canine side.
In the post premolar area, the remaining buccal bone thickness is less than 1. So I will do GBR to make appropriate bone contour.
The first premolar also anchor height is 1 millimeter, 2 millimeter.
2 millimeter,
2
same.
millimeter, same. Yes.
And in the anterior side, I will use genogenic bone AOS.
Yeah, he did the GBR with the genogenic bone, bovine bone. AOS is bovine bone, and for the space maintaining. Yeah, this is the bovine bone, genogenic bone. Yeah, because the anterior area is labial bone is very thin, so the Dr. Kim want to the more predictable results. So he did the xenograft, AOS bovine bone. And the place this is the Ossbuilder. As you know, the Ossbuilder is three-dimensionally preformed the titanium mesh, and yeah, this is a cover cap. Cover cap is very thin, so you can see the cover cap to the anchor at the time the Ossbuilder is tightly and the good stability. And this is the canine area also. The assist have hold the position of the Ossbuilder.
OSSGuide. And then to minimize the exposure during healing, I will cover this Ossbuilder with resorbable collagen membrane.
Yes.
수화하지 말고죠.
Dr. Kim said that Ossbuilder is a kind of the titanium mesh, but actually the titanium mesh is not GBR. So he did for the more good results, he did the OssGuide, is a collagen resorbable membrane.
This is a soft collagen membrane.
Collagen membrane.
As you can see, that's very soft after hydration.
Yes. So usually the collagen membrane is after the hydration, the management is very difficult. So he applicated the reservoir membrane. After then, the soaking of the saline
And
with the
also,
syringe.
I placed this collagen membrane over the lateral window. And then, to get tension-free primary closure, I will do periosteal releasing incision.
Yes, yeah, because of he had the abundant labial side is bone augmentation, so we have to do tension-free closure. He did the periosteal releasing incision for the tension-free mucosal flap adaptation. He did the collagen membrane covering with the Ossbuilder and the lateral window side also, and the large one. And after then, Dr. Kim, what kind of the suture materials you did?
This is a PTFE suture material, vortex suture material.
Yeah. Dr. Kim used the
안녕하세요.
PTFE
보세요.
suture material.
마침. 락스터 준비해줘.
Yeah, Dr. Kim make the first closure with the anterior side first, and use the close the good repositioning of the mucoperiosal flap. After then, posterior side second, and maybe the end of the anterior and the posterior use the correct position of the mucoperiosal flap. Yeah, I think it's very important. Because from the anterior side first, after then, sometimes the distal side is very difficult. So he did the suture anterior first, after then the most posterior side, and after then the middle area, and the repositioning of the mucoperiosal flap. And such as the GBR, most important is tension-free suture. It means the mucoperiosal periosteal releasing incision. And after then, the mucoperiosal flap is very easily approximate to the original position.
So I will make only key suture in the right side and then move to the left side because I don't have enough time now.
I see. He did the suture, the key points, key area, and the anterior area, and the posterior area, and the middle area.
Over the membrane, over the Ossbuilder, I will make a horizontal matrix suture to get watertight, meticulous watertight suture.
Yeah, Dr. Kim has its key suture to the anterior posterior, and after then this is the horizontal matrix suture for the watertight.
The main purpose of this horizontal matrix suture is that this kind of everting suture.
Yeah. Yeah, eversion of the mucoperiosal flap, and for the good approximation of the mucosal flap.
Okay, let's move on to the left side.
Yeah, now is the move to the left side because of we don't have enough time. So the
Okay. 오른쪽으로 살짝만 담아보시고요. 여보세요?
yeah, I think that the operation field is very wide, and sometimes some bleeding. So the patient has a slightly painful. So the Dr. Kim more anesthesia. During the surgery, sometimes the wide exposure of the operation field. After then, some bleeding, and the patient has a slight painful. At the time, the more additional the anesthesia. Dr. Kim, we have enough time, so you do not hesitate. No
Thank
problems.
오른쪽으로 돌려보시고요. 살짝만 당으로 보시고 뼈가 많이 없어져서
Yeah, you can see the exposure of the implant thread of the canine area. After that,
as shown, there was some small population, but after flap elevation, the small population was sealed.
yeah, Dr. Kim said the small population is
Membrane
observed in the sinus membrane, but after the elevation of the sinus membrane and the spontaneous folded and the spontaneous repair of the small population, usually
During bone grafting, the bone graft material can be migrated through this small population during bone grafting. So, to prevent the bone graft material migration, I will
yeah, I see.
cover this small population side with the collagen
collagen
membrane.
membrane. Yeah. Dr. Kim said it's a small population, but he don't want to migration of the graft material into the sinus cavity, so he prevent the migration of the graft material, usually using such as the collagen membrane. And after then, graft material inside of the sinus cavity, this is allogenic bone graft materials.
그거죠. 켄타마이신.
He did the compaction of the allogenic bone graft materials inside of the sinus cavity. I think that he did the aspiration of the mucosal of the sinus cavity, and so the small population was occurred of the sinus membrane, but there is no
This
big
is
problem.
aminoglycoside antibiotics to prevent the infection.
Yeah, I see. Yeah, he did the aminoglycoside, the antibiotics solution with the saline, and for the prevention of the infection, post-op infection, because of the small population, and after the aspiration of the cystic contents. And the compaction of the graft material inside of the sinus cavity. He did the sinus grafts using the allogenic bone and shows, but this allogenic bone is not demineralized, only the freeze dried cortical bone.
Okay, the sinus bone grafting was done. Okay, I can feel some rebounding. 0.5짜리 하나 더 줄게요. 빨리 줘.
Yeah, Dr. Kim has a compaction of the graft material. After then, the rebounding of the graft materials is fully compacted of the sinus cavity.
아직 아파요? 네, 거의 다 돼가세요. 지금이 제일 중요한 부분이라서 조금만 도와주세요.
Yeah, he did the sinus graft with the allogenic bone.
오스가이드 아까 똑같은 거 준비해. Okay, I will reposition the lateral window.
Yes, Dr. Kim replaced the original the position of the lateral window cortical bone, and to the
In the second premolar area, 4.0 by 10, 4.0 by 10.
yeah, the second premolar area is the fixture is diameter is 4.0 and the length is 10 millimeter, and place the TS3 implant in the slightly deep position.
And the first molar area,
Yeah, and the
5.0 by 10.
yeah, this the first molar area also only the drilling of initial drill 2.8 the initial drill of the OneGuide drill. After then, positioning of the diameter is 5.0 and the length is 10 millimeter TS3 fixture.
Initial stability is not so bad.
Yeah, the initial stability is not so bad. And the second molar area is also diameter is 5.0 and the length is also 10 millimeter TS3 implants. It looks the primary stability is good.
예. 커버 스크류. 스마트 필터 준비해주고 3번 하나만. 예, stability is not so bad. Not too bad.
Yes. The final positioning of the fixture with the hand wrench and the primary stability is not so good. Not so bad. That's good.
십 10분만 더 줘. (4번도) 4번에 안 쓸 거야. 4번은 그거 쓸 거야. 커버.
Yeah, he placed the cover screw, second molar and first molar and the second molar and the second premolar and the
예. 뎁스 컨트롤 하자.
first premolar is also cover screw. After then, this is the depth control of the canine implant.
So in the canine, I will use this smart builder, Ossbuilder.
Yes, Ossbuilder with the anchor. The anchor height is also 2 millimeter.
Yeah, 2 millimeter,
네,
right.
2 millimeter.
AOS.
And he did the GBR on the right labial side is Ossbuilder. Ossbuilder is bovine bone and genogenic graft materials.
This is AOS.
Yeah. He did the genograft for the labial side of the fixture because of the genograft is not resistance for the resorption and the space maintaining is more good than the allogenic bone. So he did the grafts, bovine bone, AOS.
Cover.
And then place the Ossbuilder of the canine area and the cover cap. And the assistant to hold the position of the Ossbuilder. And this is the Ossbuilder.
So another bone graft material, another part of grafted area should be covered with this resorbable collagen membrane.
Yes. Now the Ossbuilder is a new design, is very convenient for the holding the anchor screw, and the cover screw is very easily placed, and the driver diameter is 0.9. And he did application of the resorbable collagen membrane to the goods area. After then, saline soaking and cover the Ossbuilder and with the lateral window area also. The OSSguide is a resorbable collagen membrane.
So entire GBR side was covered by OSSguide, collagen membrane. I think complete containment of graft material is most determining factor to get successful bone regeneration. Okay. 블레이드 바꿨어? Yeah. I will do periostal releasing incision to get tension-free primary closure.
Yes. Yeah, he had the labial side is abundant the bone graft bone augmentation, so he did the periostal releasing incision for the tension-free flap and the tension-free suture because of the releasing periostal incision.
And then submucosal dissection.
Yeah, he cutting the periosteum after then the slightly dissection of the submucosal and the releasing of the tension-free adaptation of the flap. Yeah, he did the key suture of the anterior side and the good approximation of the original position of the mucoperiostal flap, and there is no tension. Tension-free suture is very important. Sometimes the suture is tight, but usually the tension-free approximation of the flap is very important.
물 삼키지 마시고요. 네. 목 막으시고요.
He did the key suture of the anterior side. After then, most posterior side also because of the exact the original position of the mucoperiostal flap. Key suture anterior and posterior. And after the middle area, where he will do the suture. He make a suture with the PTFE suture materials, Gore-Tex suture materials, and the middle area with the you can see the flap is very good approximated. There is no tension. Tension-free suture is very important.
Over the GBR side, matrix suture will be done.
And he did the of the matrix suture for the on the GBR side and more tight suture.
How much time do I have now?
Yeah, we have the almost the time, so you
Sorry.
have to. No problems. You did the good job, but we have the.
As
Now-
shown in this suture,
Yes.
with this horizontal matrix suture, I could get eversion
Yes,
of
I
margin. So let's see. No descent.
Yeah. Yes. Yeah. And Dr. Kim did the horizontal matrix suture. After then, you can see the eversion of the flap, and there is no denudation of the flap.
So after taking panorama, I will finalize the suture. Suction해. 이 하나만 더 닦고 파노라마 찍어주면 돼. Q&A 하고 저 다 할게. 마트도 준비해주고. 응. 아니 여기서. 응. 어디서든 상관. 아, 그냥. 일단 판으로 맞추고. 파노라마 찍고 마무리할게요.
Oh, let's welcome Dr. Kim and your wonderful
Thank you.
surgery.
Because of your
And-
nice guide.
I believe your lecture and the live surgery is very good and for the very benefit for the every audience. And I think that your lecture of this year is very extensive experience of the OneGuide.
Yeah.
Do you have a particular reason you choose this case as a live surgery?
So in the last year, I focused only on the OneGuide system. So very minimally invasive surgery with OneGuide system. But so in this year, I always considered how can you use this OneGuide system in fully edentulous patient along with the GBR or sinus surgery.
Yes.
So for that reason, I decided this patient.
Yes. I think that there are so many questions online, and we have to choose some questions discuss with you. And the first one is, how long will you wait until the final loading?
Yeah, so usually after lateral approach sinus bone grafting, second stage surgery will be done usually 4 to 5 months after surgery.
Yeah.
And then I'll check the ISQ implant stability quotient. So more than 70, final impression taking can be done, but less than 70, wait one or two more months.
Yes.
Yeah.
Do you usually progressive loading or such as the temporary?
Yeah. So if I could get the ISQ value more than 70, even though I have waited more than 6 months, at that time, I usually do progressive loading.
Yes. And the second question is, when will you deliver the temporary denture? It means you did the cover screw, and even though the anterior side is canine area is the Ossbuilder GBR, and you can when you deliver temporary denture.
So usually 2 weeks after surgery, suture will be removed. But until that time, the soft tissue healing is not so good. So so I usually wait 3 to 4 weeks after surgery to deliver the denture over the GBR side. So I wait around 3 to 4 months, 3 to 4 weeks. Sorry,
3 to 4 weeks
yeah.
after then the temporary denture. And the third question is, you did usually the sinus graft only the allogenic bone materials.
Right.
So do you have any special reason of the allogenic bone graft material?
Yeah, so as I said during my live surgery, the main disadvantage of allogenic bone is a severe resorption rate. But even though that resorption rate, I always use allogenic bone inside the sinus cavity because only this allogenic bone can be replaced by patient own bone. So to maximize bone implant contact ratio around molar implant, I usually use allogenic bone.
Yeah, he said he used the allogenic bone is more good replacement of the host bones.
You're right.
And the next question is, you did the lateral window with the straight handpiece.
Yeah.
What speed do you use?
So when using the straight handpiece, we can use 30 to 40,000 RPM. So quite good, higher than implant handpiece.
Yeah, I think that you are very expert for the lateral window, but sometimes the some beginners is very difficult to
maybe
perforation of the sinus membrane. Yeah, but you did the good operations.
I was so lucky.
And the you used the smart builder, Ossbuilder.
Yeah.
And the how can you choose the appropriate size of the Ossbuilder?
Yeah. So during the planning with OneGuide system, so I could expect the size of implant exposure. So based on that, my planning, I could select appropriate size and shape of smart builder. But usually, to select appropriate size and shape of smart builder, right after implant placement, we should check the shape of peri-implant bone defect. So based on that peri-implant bone defect shape, we can select appropriate shape. And then after measuring the buccal-lingual width and mesodistal distance, we can select appropriate size of smart builder.
Yeah, I think that there are many sizes of the smart builder, Ossbuilder, so that you can choose appropriate size.
Yeah.
And there is you did the flattening drill of the anterior area.
Yeah.
So there is a question: why didn't I use the bone flattening drill in posterior region?
Yeah. So usually anterior area has very irregular alveolar ridge.
Yes.
So when considering the shape of OneGuide drill, so irregular alveolar ridge crest should be flattened. Total region, so I used the flattening drill in the anterior side. The posterior area, the alveolar ridge shape is flat.
Yeah, I see.
No need to use.
Yeah, usually he said especially the anterior area is alveolar bone is not irregular. Is irregular at the time. Flattening drill is maybe first choice. Yeah, I think that there are so many questions, but we don't have enough time. I'm so sorry. So this year maybe now is post-operative the panoramography. Yeah, you can explain some.
Yeah, so by using the OneGuide system, I could place implant in ideal position with ideal angulation. But unfortunately, only left upper canine implant was drilled without OneGuide template. But I could make an initial drilling point in the ideal position, so the position and angulation was not so bad.
I think that you are very expert. So even though the slippage of the implants, but you can did the side cutting drill more palatally after then place the original position. Yeah, I'm so sorry we don't have enough time. So now we have to close the Q&A sessions on this OSTEM meeting online. This year, maybe the OSTEM meeting online will be held several times, and we will hold the more several the OSTEM meeting online in the future. And thank you very much, and we appreciate your interest and the support for this OSTEM meeting online. And thank you very much for watching. Yeah, thank you.
Thank you.